Hi everyone, hope you are all well and thank you for attending this live webinar. I am Dr. Hani AbiGhosn. I've been dealing with the company of Sistema, Phormae, Luxville, and recently the Remodel. And I am very pleased today to share with you my experience about these beautiful products. I'm going to be sharing my screen now so we could go through the presentation we've already prepared for you guys. All right. So we are today gonna go through how to master the skin boosters and the dermal fillers. I'm gonna try to share again. I'm not sure what's happening. All right, should be fine by now. So I'm not sure what's going on with the sharing. I'm just gonna try to share it again. Just a minute. It's okay. So we're gonna go through this presentation. I'm sorry, it's not sharing for some reason. So I'm gonna start with the Remodel actually, which is the very latest fillers I've been using for some time, and I'm really loving it. So what are dermal fillers at the start? Well, dermal fillers are a product usually based either with hyaluronic acid or calcium hydroxyapatite or polylactic acid or other biocompatible materials. We can apply them in terms of volume restoration in several areas, whether the cheeks, the lips, the nasolabial fold, the chin, the jawline, and the under eyes area. So what are the benefits? The benefits of the dermal filler, as you may all know, are for immediate volume restorations, for softening the facial lines and wrinkles, and also for the contour enhancement when it comes to a thick filler, like in terms of cheekbones, jawline, chin enhancement, etc. Dermal fillers also, of course, present several risks. It could be bruising, swelling, redness on the injection site. Some rare complications can include infection, vascular occlusion, especially if it wasn't undergone by a specialist and someone who's mastering well his facial anatomy, and also some rare allergic reactions that can appear in some individuals. So, now, the dermal fillers, how does it go? Actually, first, it's very important upon the first visit of the patient to assess a complete medical history. Also, discussing patient expectations is very crucial, and also the risk assessment, depending on each skin type, anatomy, and lifestyle of the patient to tailor the treatment plan accordingly. Now, what's with Remodel? Remodel is actually not only a dermal filler, but also it has an innovative formula with restoring features. So the world of Remodel is actually quite interesting because when you're using Remodel, you're not actually only injecting hyaluronic acid for volume restoration or any other indications. You are also injecting, along with the hyaluronic acid, quite important and crucial amino acids, which are the proline and the glycine. Proline and glycine are actually extremely interesting when it comes to combining them inside a dermal filler. The proline is actually a substance that we find in the bone broth and is a precursor to the synthesis of collagen, and the glycine as well has quite restorative properties. So when we're using the Remodel, we're not only having a volume augmentation or any other classical indication of a dermal filler, but also we are inducing a tissue regeneration, a new collagen synthesis, and quite other benefits for your patient's tissues. Remodel has three distinct formulations. We've got the L, which goes for light, the versatile Remodel, the M, which goes for medium, and the S, which goes for strong. So the Remodel L is ideal for periocular wrinkles, superficial wrinkles, and the perioral area. The Remodel M is perfect for enhancing lips, treating nasolabial folds, restoring medium volumes, and refining the nose. And the S is designed for defining mandibular angles, to do like a proper face contouring, anywhere we need like lots of volume, volumizing the facial contours, including chin area, and the overall face remodeling. So here we can see a bit, so why to choose the Remodel dermal fillers? They actually use a quite advanced cross-linking technology and an ultra-pure pharmaceutical grade hyaluronic acid for optimal safety and effectiveness, with tailored options like the L for delicate areas, the M for the lips, nasolabial folds, and the S for deep contours, like quite significant volume losses. And these fillers ensure natural-looking results that integrate seamlessly with the skin, providing lasting enhancement and natural beauty. So the tailored formulations for treatment areas are a quite big advantage of the Remodel range, and also because we have an enhanced tissue integration and safety, thanks to quite advanced technology in the manufacturing. So as we said, we have three types of Remodel. So the gentle, the versatile, and the intense. And I would like actually to stress on a point that's quite interesting. It's been actually very interesting for me as well, that now we've got a 20 pounds off each box on the Systema.co.uk website. This is an offer that's valid until the 27th of October. I personally jumped on that quite quickly because that's something like extremely interesting. So you can just use the discount code WEB20, WEB20, on your checkout, so you can get the £20 off each box you order on the Systema.co.uk website. So now I'm gonna go to the skin boosters. First of all, I'd like to start with the Phormae. Phormae is a skin booster that I personally love. I've been using the Phormae booster for over 18 months now, with countless success stories and people quite enthusiastic about their sessions and the treatment itself. So what's with Phormae? Phormae is a high-quality hyaluronic acid that deeply hydrates the skin and improves elasticity and suppleness. The technology incorporates innovative cross-linking technology for enhanced durability and longevity of the results, ensuring gradual and natural-looking improvements. Treatment areas actually include lots of areas in the face, like the cheeks, nasolabial fold, the marionette lines, and other regions requiring like volumization and deep hydration. It is actually administered through micro-injections into the mid to deep dermis. My favorite technique for the Phormae is the 5 BPA points. And it actually promotes collagen production for a more plump and rejuvenated appearance. Benefits are countless. You have immediate volumizing effect and long-term skin revitalization, reducing appearance of the fine lines, wrinkles, and uneven skin texture. What's the protocol I recommend for the Phormae? Typically performed as a series of 3 sessions, spaced 2 to 4 weeks apart, and then followed by maintenance treatments every 4 to 6 months, depending on each patient age and skin type. Phormae is obviously CE marked and rigorously tested to ensure safety and efficacy, suitable for all skin types and skin tones. Also for Phormae, you have the £20 off each box on the sistema.co.uk website by using the discount code WEB20. So Phormae is actually the skin booster that I would recommend to young skins. Like I personally use Phormae on patients that are 40 years minus, and I keep the more mature skins for the Systema use. I'm gonna go through the Systema now, one of my favorite skin boosters I've ever used. It's actually the most demanded treatment in our clinics nowadays. Systema, like everyone wants Systema, everyone wants to repeat his sessions because like seriously the results are mind-blowing and very, very long-lasting. So what's really special about the Sisthaema Hevo-T? Well, Systema contains also hyaluronic acid, obviously. It retains moisture, hydration, deep hydration to help plump up the skin, reduce the appearance of fine lines and wrinkles, and the skin appears more supple and rejuvenated. And believe it or not, results are quite fast. I usually tell my patients they need to wait 7 to 10 days to start seeing results. But honestly, with the Systema, sometimes the next day we can start like a skin enhancement and improvement in the skin texture. So it gives an improved skin elasticity and firmness by replenishing moisture and stimulating collagen production, and also increased elasticity, and also helps combat signs of aging as a sagging and loss of firmness. And what's really unique about Systema is that we have paired with the hyaluronic acid a quite interesting sugar, the trehalose, which is an antioxidant sugar. And it's not only antioxidant, it also slows down degradation of the hyaluronic acid, whether the hyaluronic acid that we are injecting in the skin booster or the hyaluronic acid that is pre-existing in our own tissues. So this is why when you offer the Systema treatment, you are only also offering an anti-aging procedure, also offering antioxidant properties along with the hyaluronic acid and its deeply hydrating properties. And this is why Systema, to me, is one of the most long-lasting skin booster in terms of durability of the results and the depth of the treatment. Now, unfortunately, maybe I cannot, I'm not sure if the presentation, you can see it, but very, very interesting before and afters that you can also check out on the Systema.co.uk website. And by the way, also Systema is on the current offer. It's valid only until 27th of October. £20 off each box on Systema.co.uk website by using the WEB20 code. So there are obviously some risks if you want with the skin booster. They're very rare, but you need to know it, and you being healthcare professionals, and you might encounter some of these. Temporary redness and swelling are very, very common. You might experience mild redness, some swelling at the injection sites. These effects typically resolve within a few hours, maximum a few days in quite sensitive skins. And some rare allergic reactions or infections. To be honest with me, I've maybe had several hundreds of treatments of Systema to a large amount of patients. I've never had any allergy or any infection, but it's documented. So we'd rather be aware that you might have some rare allergic reaction either to the hyaluronic acid or some other ingredients in the skin booster. Infection can occur, but that is only if you're not operating in sterile conditions. We need to quite clean well the treatment area. If there is makeup, proceed to a very proper makeup removal before using an antiseptic. So the procedure needs to be performed under sterile conditions. And other considerations are the bruising. Bruising can occur. I usually use some cooling before the injection because the hyaluronic acid is quite dense. patients might experience some slight pain during the injection. So using the cooler prior to that would reduce the pain and also reduce the risk of having bruising on the injection site. The patients with a history of cold sores should inform their practitioner to prevent flare-ups. So the ingredients, as we said, contains high purity hyaluronic acid to hydrate and plump the skin. The trehalose, that amazing antioxidant sugar, and it was such a bright idea to combine it to the hyaluronic acid in the Sistema Hevo-T product. Technology utilizes advanced delivery systems that ensure deep penetration of the active ingredients for long-lasting results. The treatment areas, Systema is like such a versatile skin booster. I use it like almost everywhere. Like wherever there's skin, there's advantage of injecting Systema. Ideal for multiple areas, including the face, the neck, the décolletage, the hands, the knees, the abdomen. Like the knees and the abdomen is like outstanding results. So this is how we can address a wide range of aesthetic concerns thanks to this product. So it is administered through a series of micro injections into the superficial layers of the skin. I personally use the 5 VPA technique as well for Systema. Sometimes I use the TENS technique, but kind of results are pretty similar. Benefits are so many benefits, like it provides immediate hydration, noticeable improvement in skin smoothness and radiance, and over time it helps reduce even the fine lines quite superficial on skin surface, wrinkles and crinkly skin. The protocol I recommend is a course of 3 treatments, spaced 2 to 4 weeks apart, and followed by maintenance session to be fixed depending on each skin type and each patient case. It is, of course, CE marked, clinically tested, and also safety and efficacy are guaranteed. So when we say injecting Systema in the face and the neck, I'm gonna just brief you a bit about the injection technique, and then we're gonna go through the injection in the abdomen because this is where we see like mind-blowing results with Systema. So in the face, I do 5 injection points per side. The 5 BPA technique that you can actually also see on the website of the product. 0.2 ml in each point because the syringe, as you may know, is of 2 mLs. So this is to maximize the spread and less risk of complications. In the neck, we actually provide also 10 injection sites, 0.2 ml in each side. It doesn't have to be quite deep, like I would inject about 3 millimeter depth. It's more than enough. And as I said before, cooling prior the injection reduces risk of bruising and also reduces the pain experienced by the patient. So also, as I said, I would do the second session 2 to 4 weeks after, and then a maintenance session has to be cyclic depending on each patient needs. Regarding the abdomen, well, in the body areas, I use the double quantities that I usually use for the face and the neck or the décolletage. So I use a total of 4 ml per session. I would do 10 injection sites on the abdomen with 0.4 ml in each injection site. Depth would be 5 to 7 millimeters, depending on how thick the skin is, with an injection angle of about 30 degrees. So 10 injection points, 2 in the upper belly, 2 on the lower belly, and 3 on each side of the patient navel. This is where you have the maximum spreading of the product. And then you will see with about 2 to 3 weeks, like the whole aspect of the abdomen would change. The skin laxity would almost disappear. And this is an amazing treatment for like patients who have experienced a heavy weight loss, for women in their menopause, or women after a delivery where they experience like kind of skin laxity. So this is the best application when you've got like only the skin is loose, whereas the patient is actually quite firm and has got quite nice abdomen muscles structure. So this is where you could actually just improve the skin aspect, and this is where they get like mind-blowing results. So this is like pretty much everything. A last reminder about the offer that's expiring on October 27th. Use the code WEB20 to have a £20 off each box, either Sistema, Phormae, or the Remodel fillers, which are fillers like I'm really crazy about. I hope you enjoyed the presentation. If you've got questions, maybe you can drop them in the chat box. And thank you very much for listening. And I hope it was useful and informative. So we've got a question from Amira. Are there any long-term complications after procedure? So Amira, there are no long-term complications. Like, I consider myself having enough long history with the products, and we've never had any complications, whether with the fillers or with the skin boosters. Of course, when they're injected in the right layer and when they are treating the right indications. Guys, please do not hesitate to drop any question you've got in the chat box, so I could actually reply live on the video. I'll be waiting for a few more minutes if you've got anything to add. I'm not sure if you got something in the... Thank you very much, Amira, for listening. So Amira is saying this was an informative lecture. I'm really glad you've liked it. And in case the screen wasn't sharing for some reason, the presentation, we will be posting it on the Facebook page. And if someone needs it, we can actually also email it to you if you want to keep it for your reference. So Jenny is asking, sorry, I have just joined. Just wondering if the skin booster is only containing hyaluronic acid. So for the Phormae, we mainly remain on the hyaluronic acid, which is quite classical, because it's made in a way where it grabs water and gives skin plumpness and deep hydration to the tissues. Whereas in the Sistema Hevo-T, we've added an antioxidant sugar, as I previously mentioned in the presentation, the trehalose, which is an antioxidant sugar. So when you are injecting Systema, you are also offering an anti-aging procedure. And the trehalose, as I explained also, slows down degradation of hyaluronic acid. This is why Sistema Hevo-T has a longer durability in terms of results. And it also not only slows down degradation of hyaluronic acid we are injecting in the product, but also our own hyaluronic acid we already have in our tissues. Jenny, I hope this was clear enough. If you've got further questions, please do not hesitate. Jenny, how does it compare to Profilo? It is the same technique. As I said, Profilo does not contain antioxidants. It's only hyaluronic acid. And Phormae and Systema have got different technology in manufacturing the hyaluronic acid, so that's why it's of a higher purity. Yet these are they have pretty similar indications. SM facial aesthetic stay. I love Systema, giving such a great result. Well, it's one of my favorite treatments in the clinic, to be honest. It's been like quite successful and very, very highly touted by all our patients, whether Systema, Phormae. And if you haven't tried the Remodel fillers yet, go for it. They are quite pure. I forgot to tell you that Remodel also contains 60% less BDDE than any other filler in the market, which gives less risk of swelling and much less risk of bruising, with a very, very reduced risk of any allergy reaction. It's a very, very important point, actually, because the hyaluronic acid we use for fillers has to be cross-linked, and BDDE is one of the cross-linking ingredients that is widely used in manufacturing the dermal filler. But purifying the dermal filler after the cross-linking is quite challenging. So having 60% less BDDE in a filler is to me a quite important achievement. Me being a pharmacist is a quite huge achievement. Can it be used as preventative? Definitely, it can be used as preventative, Jenny. If you've got patients that are young, like less than 40 years old, I would recommend the Phormae. If you've got people like over 40, but they still haven't shown like quite visible aging signs, you can definitely go for the Systema. I personally also use it for my patients as a preventative. SM Facial Aesthetics, waiting for a stock, can't wait to try Remodel, will be great for clients who are having a scar tissue and lips. Absolutely. Yes, you try the M for the lips. They're going to love it. Yeah, you won't have any scar tissue problem using the Remodel, definitely. So Amira, you are asking any discovered disadvantage regarding what product? And Jenny is asking how often can you have the treatment? So Jenny, I have explained, depending on the patient age, what I usually do is a course of 2 to 4 weeks apart of Systema or Phormae, and then the maintenance session would be fixed depending on each skin type. It could be 4 to 6 months apart in terms of maintaining the result all year long. There are no disadvantages for Systema yet. And I would really recommend it in the body. Like, you have no idea, even the elbows, even the hands, the abdomen, the inner thighs. In the inner thighs, it's mind-blowing for people who have experienced weight loss. I also used it for a patient who had a liposuction on her inner thighs, but they removed quite much of fat, so she had quite loose skin, and now she's got brilliant thighs. I wish she accepted to have before and afters. I would have shared it with you. As I said, in the body, I use 4 mLs per session, so 2 boxes. You are welcome, Jenny. Does it create a pillow face in the long run? It doesn't. It doesn't, because by the time you would produce you would do your following session, the result would have been reduced, and also there is no pillow face because it's not a filler, it's not cross-linked in a way where it does volume restoration or volume augmentation. It is just hyaluronic acid to grab water and provide with a deep hydration. It does plump up the skin, but doesn't give like an extra volume like the dermal fillers. So there is no pillow face risk with the skin boosters. Guys, I'm still gonna wait for 2 minutes just to see if anyone has any question to drop. If you would like to check the presentation out, you can go on the Facebook page of Systema. We will be posting it, and if someone requires it by email, you can email the company, and they could send you the presentation with all the before and afters. And do not forget the Web 20 code. Don't miss the opportunity. It's just 1 week is left, and it's honestly worth it for your upcoming purchases. What other treatments have you combined with to take the results for the next level? So this is a quite interesting, very interesting question, Jenny. When it comes to the face, depending on each case, when there's lots of laxity, I combine it with threads. When there is volume loss and extreme weight loss, I would combine it with dermal fillers. When it comes to revitalizing the skin and improve the quality, sometimes I combine with either mesotherapy, like it could be polynucleotides, it could be just vitamins. And recently, I've been also combining with the exosomes, and it's giving mind-blowing results. But whatever I'm using to improve someone's face, Like the skin booster is always my pillar, and I combine around some other treatments that I catered depending on each patient needs. All right, guys. Thank you so much. Thank you for everyone who has listened. Thank you for your questions and your interest. Do not hesitate if you need anything else. You could. Okay, there's the last question by Jenny. Do you combine on the same settings, or you give a gap between treatments? It depends. Like I would do dermal fillers and the skin boosters at the same time. When it's for polynucleotides and mesotherapy, they can be done in the same session. However, just to reduce the amount of needles the patient is having, I usually space them up like by a week. And yeah, so the thing is, when there's something that needs lots of needles, I usually space them up for the patient to feel more comfortable. Yeah, for exosomes or meso, as I said, they can be done at the same session, especially if like a patient is traveling and is not in town for a long time. But if we can make the treatment more comfortable, I could space them up so they wouldn't like get lots of injections on the same day. You are most welcome. Thank you so much for everyone. And hopefully I'll be seeing you in another live very, very soon. Take care and have a good day. Thank you.